People are still filing in, but we want to make sure we get started and be cognizant of all of your time. Welcome to San Joaquin Community Hospital. My name is Jimmy Phillips, and I'm the Executive Director of Marketing and Communications here at San Joaquin, and we are just thrilled to have you on campus today for what really, truly is an event that saves lives. And I'm going to tell you more about that here in just a minute. How many of you have been to one of our monthly lectures before? How many of you have been? That's good. So we have a lot of first-timers here. Well, this is something we do every month. It's part of our ongoing community lecture series, and every month we present on a different healthcare topic. And just a little bit of a preview, next month we're going to be doing something with a new neurosurgeon that we've brought to town on back health and how you can make sure to, anybody have back pain? Anybody that ever happened to? Yeah, happens a lot, right? So look for that one. Look for me on TV, look for our ad in the paper and our ads on social media and such, but we'll get the word out about that as soon as possible. I do want to let you know today we're focused on heart care, obviously. February is National Heart Month, so it's kind of at the height of heart season, if you will, but it's something that affects people all year round. Of course, you know that heart disease is the #1 killer in the United States for both men and women. And so this is a topic that is near and dear to many of us. I'm sure there's people in this room that have been afflicted with heart disease. I'm sure that there's people in this room that have lost somebody to heart disease. First and foremost, what we want to do today is make sure that we give you the tools that you need to learn how to prevent ever needing to come to the hospital in the first place. That's what we're here for first and foremost. But if you do ever need to come to the hospital, we want you to know something really spectacular has just happened. San Joaquin Community Hospital, as you see on the screens here, has just been named one of the 100 best hospitals for heart care in the entire nation by Health Grades. Oh, thank you. Yeah, clap. That would be great. That's regardless of size of hospital, so it's across all hospitals. When you consider that there's about 5,500 hospitals in the United States, that's quite an accomplishment. So it's the first time that any hospital has ever been a recipient of this award here in Kern County. So we're incredibly proud of this, and it's just a testament to the work that our heart team does every day. So they just deserve all the accolades and all the credit we can give them, and we're going to have members of this life-saving team presenting to you today. Just real quick, a few more things I just want to point out to you. In addition to receiving the Top 100 award, we were also recently named a distinguished hospital, which puts us in the top 5% of hospitals in the nation across all care. And again, this is the first time that a hospital in Kern County has ever received this award. So this encompasses stroke care, heart care, care for orthopedics, pneumonia, sepsis. Across anything you might get, we've been ranked in the top 5% in the nation. We've also been named, in addition to the Top 100 award for heart care, Top 100 for coronary intervention, which is a little bit more technical, but it has to do with our cardiac care in the same way. And then I'll mention to you at the bottom, we're the only hospital in Kern County to rate 5-star for coronary intervention, treatment of heart attack, treatment of heart failure, and defibrillator procedures. So there's just a number of things that San Joaquin has really done a great job of separating itself from the other hospitals in Kern County. You can get great care here in Kern County at many of our hospitals, but we believe you get the best heart care here at San Joaquin, and these awards are evidence to that. So awards matter, but what matters the most is lives that are saved, lives that are changed, and I just want to share with you guys a story this morning of someone who actually came to this very event last year, almost a year ago to the day, and as a result had a life-changing experience.
To get a second chance in life is amazing. It's changed my whole outlook on life, on people, on everything.
I've worked at San Joaquin Hospital for a little over 5 years, and I saw the advertisement for the lecture on Facebook. So I've been trying to make a point to attend every one of them, and this one happened to be on how to recognize a heart attack.
Like most men, all I heard was wah, 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 wah.
If you feel like an elephant sitting on your chest, and to call 911 immediately and not to be embarrassed.
A week later, morning there was a tree that's been bugging me for about a year. And I was gonna dig it up. And after about 10 minutes of digging, it felt like I got kicked in the chest. I went down on my knees and I started thinking, is this an elephant? Is this what an elephant feels like? I called 911 and they were asking me, you know, do we need a fire, police, or ambulance? And I said an ambulance. I think I'm having a heart attack.
After hearing the news, I think I was in shock. I wasn't sure how to respond. I just know if I had not gone to the lecture and came home and discussed that with him, that he probably wouldn't be here today, because he probably would not have called to ask for help.
When I came to, I believe I said what happened, and they said I had a heart attack, and I couldn't believe that. It was still just, no way, not me.
I am so thankful for the team at San Joaquin, everyone from the cath lab to the ED, the nurses and care partners on tele and ICU for educating us on what to expect when we go home.
I'm still just overwhelmed by the generosity, the love that the employees gave me. I mean, I never thought that people that worked in hospitals actually cared that much and were genuine.
So we're a lot more appreciative every day of having another day together.
This heart attack has changed my life in everything. From the way I wake up in the morning to the way I go to bed at night.
Every morning before I go to work, we pray, just thanking the Lord again for giving us another day.
This has strengthened my faith beyond. I can't even put it in words.
Every morning, whenever we pray together, before I leave for work, we pray about how we're so thankful that the Lord has given us another day together.
I'm still just blown away and so grateful.
It's really cool. Crosby and Veronica are here today. Could you guys stand up for us? Like I said, almost a year to the day. So what I take from that story is you have an obligation after what you're going to hear today. Take it home to your spouse, to your friends, to your family, and just share some of the information that you learned today, because it really can save lives, and it's extremely important. So with that, let's get into our presentation. We have two great presenters for you today. Our first will be Stella Williams. Stella has been the coordinator of our chest pain center here at San Joaquin since we became an accredited chest pain center, and much of the great work that happens in our chest pain center, in our heart program, has been a result of Stella's excellent work. And she's going to be followed by Dr. Sam Singh. He is the medical director for our cardiac cath lab. So you're in for a treat. At the end, we will have time for questions. So start thinking about some questions you'd like to have answered. But without further ado, I will turn it over to Stella.
Hey, hello, welcome. It's Heart Month. What do you think of in February? Valentine's Day. Do you all have a nice Valentine's Day? So Heart Month is also the month of love. So let's start off with showing our heart a little love. So right from the get-go, I'm going to give you some homework. Okay, don't throw stones at me, all right? Tonight when you go home, at the end of your day, when you're ready to go to bed, and you're counting all the blessings for a wonderful day that you had, I want you to take a few minutes and listen to the whispers of your heart. It can actually talk to you. What I want you to do is you can either close off your ears, put your head against the pillow to where you can hear the sound of your heartbeat. Feel the power of your heartbeat. Get to know what your heartbeat tells you. You know, you can take your pulse by going to your windpipe next to your carotid artery, or you can feel it on your radial artery. Anyone that doesn't know how to take their pulse, see me afterwards and I'll teach you. But what I want you to get in the habit of doing is finding out what is normal for you. Because if you don't know what's normal for you, you're not going to know when something is abnormal, right? So let me ask you, have you ever gotten into your car? We're all used to our cars, right? You ever gotten into your car and it's just not driving right? Or you hear a new sound? What do you do when that happens? Take it to a mechanic. Why do you take it to a mechanic? It's sick. And what can happen when it's sick? It can break down on you, right? Well, why don't we do that with our health? Why don't we listen to the whispers of our heart? When we know something's normal and now we're feeling something abnormal, we need to take it into the shop to get fixed, right? That's the only way we're going to stop the #1 killer across the country. We have to pay attention to what our heart tells us. Doesn't it make sense to come into the shop or your doctor or your hospital if something's wrong? So you don't wait until your heart stops beating on an ambulance gurney rolling into the hospital? You know, our video doesn't tell you that what happened to Crosby is his heart did stop. But he listened to what we told him, and he acted quickly. So we did resuscitate him. His heart stopped 2 more times on the cath lab table. If he would have hesitated any longer, he may not be here with us today. So it's really important. We have to know what normal is so we recognize when abnormal hits us, correct? You know, denial is a big part of the heart problem. This can't be happening to me. Even Crosby told you. When I woke up, I asked him what was wrong, and they told him he had a heart attack. He goes, oh, I just can't believe it. He still was in denial, even after having a heart attack. Very common problem. You know, we're all obsessed with our schedules, our commitments, our life, our cell phones. Do we have that kind of commitment to taking care of our health? We should. Because not until, like Crosby said, it knocked him to his knees, did we pay attention. So that being said, we don't want to wait till it knocks you to your knees. We want to teach you today how to prevent the heart attack. Why do we delay? This can't happen to me. I'm healthy, right? Oh, just let me lay down and rest a little bit, I'll feel better. Ever heard that from anybody before? And you know, sometimes that works. Sometimes it works. Sometimes we find them dead in bed because they've ignored those simple symptoms that could have given them a warning. I don't want to be a problem. If it turns out it's nothing, I'm going to feel embarrassed. Well, I'm here to tell you, we'd rather see you 1,000 times for it to be nothing than to miss the one time it was something. If Crosby would have ignored that, he wouldn't be with us today. So denial's a big problem. What I want to talk to you about is early heart attack here. We all know the symptoms of heart attack, right? These later symptoms, chest pain, pressure, pale, cool, diaphoretic. Diaphoretic means you're sweaty, right? I want to talk about the early heart attack here. These symptoms come and go. They come and go. They're stuttering symptoms. So do you see how easily it is to miss those symptoms? Well, it went away. But if we pay attention to what our body's telling us, if we know what's normal for us, we'll recognize this isn't normal for me. For instance, when you do your homework tonight, think about how good you feel on the days you feel really good. I breathe good, I feel good, my heart's pumping good. Get used to that, just like we get used to our car running properly. You're going to know when it's not running properly. If there's one thing you remember today, look at this red flag here. If you're out exercising, let's say walking the dog, cleaning the house, whatever it is that you do, and you develop some kind of pressure in your chest, right? Shortness of breath. Then you sit down and rest, and it goes away. That's a big red flag. A big red flag. You can't let that go. That could be a sign of your arteries narrowing, and we want to catch it before it gets totally blocked, right? Then you're going to need Dr. C to help you open up that artery. But no, we want you to pay attention to those feelings that come and go and act on them. Now these later symptoms, that's when you call 911, without a doubt. And I'll show you why. What is a heart attack? Everybody know what a heart attack is? You know, I go and see these heart attack patients after they have their heart attack. You know what they tell me? Oh, my heart stopped. Not always, but sometimes it does. So what a heart attack is decrease of blood flow to the heart in varying degrees, right? It can cause death or severe heart damage. Severe heart damage is every time you have an episode like that, part of your heart dies. It can lead to a lot of other problems. You want to have a quality of life too, right? When you survive a heart attack. So we have to recognize and respond early to these early symptoms. So here's what I want to show you. We all know about plaque, cholesterol, and all that good stuff. And Dr. Singh will talk more about this in a minute. But bottom line, we have an artery that has a narrowing. That plaque is either so closely closing up that artery, we have a decrease in blood flow, or it's totally occluded. But bottom line, we have an obstruction in our heart. So if we have this, what's happening to our heart down below? Anybody want to take a guess? It's not getting any blood, right? What's in blood that we all need? Oxygen. We can't live without oxygen, right? So guess what? This heart is holding its breath, till you come in and we open up that artery. So here's the example I like to use. We're at a party by a pool. You jump in. I'm this mean, nasty person, right? I hold your head underwater. How long can you hold your breath underwater? How long can you hold your breath underwater? I talk too fast and I can't even catch my breath. So everybody's different, right? We don't know how long that heart can hold its breath. Maybe you can hold it for 5 hours. Some only a minute. I'm talking about the heart here. Right? We don't know. We don't know how much you're going to be okay until we get that artery open. So heart attacks are not created equal. There's different kinds. 3 different kinds. There's the kind where you're absolutely down for the count. The only thing that will save you is CPR and an AED. Not a good one, right? That's why you'll see us out in the community teaching hands-only CPR. Hands-only CPR, you do not have to put your mouth on someone else's mouth anymore. Push hard and fast on the chest. It takes 5 minutes to learn. We suggest everyone in Kern County do that. The other one is the heart attack that Crosby had. This is the elephant on the chest, the Mack truck that hits you. This victim knows they need help because they have this feeling of impending doom. The third type has those early beginnings, those stuttering symptoms that come and go and come and go. This victim will complain and give you every excuse known to man why they're not going to get help. Those are the ones that are the most difficult to seek medical help. Those are the ones that are having minimal symptoms but practicing maximal denial. It's the reason why heart disease is the #1 killer. It's not always etched in stone. It's not always the pain in the chest going down the arm. It's different, especially in women. Most of the time they don't feel any pain at all. We've had older women come in with leg pain, and they've had what we call the STEMI, the back truck type of heart attack. So you have to listen to what your body's telling you. Get to know what's normal for you so you know when something is abnormal. Early heart attack care. These symptoms start sometimes 2 weeks to a month before you have the big one. Listen to them. Why do we want you to call 911? Anybody know? Get there faster. Then let me give you a clue. That kind of heart attack that Crosby had, the Mack truck on the chest, the elephant on the chest, only one way to diagnose it, with an EKG. And the paramedics do that EKG. That being said, when they get that EKG, they call the hospital and tell us you're coming in. We're going to get our team together, we're going to get our physicians here, we're going to literally meet you at the door. Because we don't know how long your heart can hold its breath. We have to treat you quickly, but you have to act quickly. So we don't want you driving. There's a campaign, Stay Alive, Don't Drive. That is why. Okay? Especially when people think, they imagine, oh, if it's not a heart attack, I'm going to be embarrassed. But what if it is? Imagine that. So our early heart attack care campaign is we want everyone to pay attention to these symptoms. And you're going to see your family, your friends, your neighbors, your coworkers having these minimal symptoms. Oh, I'll be all right. I'll be all right. Let me just rest a bit. No. Make them get medical help. It will save lives. You know, here in Kern County, we have a high mortality rate. Unfortunately, we do. We also take the longest to come in when we have a heart attack. The rest of the country usually takes about 2 hours. Most of the heart damage happens in the first 2 hours. If we take 4 hours, which is what our data says, we're already past that point of no return sometimes. And that's the sad part. When you come in and you're that sick, there's only so much that can be done. We call this kind of circling the drain. We're trying to keep you from falling down that drain. But if you're so far gone, it's hard to reverse that. That's why the earlier you get to us, the better. Okay? So the battle we have is this awakening to the mild signs and symptoms of a heart attack. Not the pain in the chest, pain going down the arm. That's when you're actually having the heart attack. Listen to what your body's telling you. The challenge, the reluctance to get help. Bakersfield is the worst. The worst. That's why we're reaching out to the community and trying to let them know. Come to us sooner. We can save your life. But you have to pay attention to what your body's telling you. So our message is simple. Those simple symptoms can save your life. We could do testing to find out if you're at risk for a heart attack. And it makes sense to come in when there's this small discomfort as opposed to waiting till your whole artery is completely occluded. Early detection is the key. Warrior plan if you have a heart attack. As Jimmy told you, we want all these awards. But you know what our true sacred work is? Yes, we can save your life when you have that heart attack, and Dr. C's going to talk to you about that. But what we really want, what our real sacred work is, to teach you how to prevent it. Thank you. And now I'm going to introduce Dr. Steve, cardiologist.
Can you hear me? You can? All right, so. All right, I think I'm going to be much shorter than this, but I'll tell you, we do have a problem, okay, in Kern County, and Stella, I'm going to need the thing to kind of move it up and down. And, yeah, is it turned on? Yeah, thanks a lot, okay. me just check that. Okay. And Stella kind of referred a little bit, but I think what I would like you to kind of think about is why are we any different than anybody else? And I'll give you the data, and it's not it's kind of saddening in many ways. So let me start off with the actual case, kind of give you, and this is the actual case, and it's not from a long time ago. This is a patient who saw his PCP, a family physician, about 6 months before I saw him in the middle of the night. 32 years old, moderately obese, blood pressure is normal, no significant family history of heart disease. His cholesterol is fairly average for Bakersfield. You know, the LDL is the bad cholesterol, 127. HDL, the so-called good cholesterol, is a little bit low. His hemoglobin A1C, which is blood test for diabetes, a tiny bit high, so you would call him a pre-diabetic. And the CRP, which is a very important test, is a cheap test to look at inflammation, was high. This was office, no symptoms, until 6 months later, I saw him in the middle of the night. Now, this is a normal right artery, and look at it, this is the catheter here, and we inject a dye. You can see it's nice and smooth. Think of it as a C. And it, as Stella was pointing out, is delivering oxygen and sugar, etc., nutrition to the heart. And this was this 32 years old gentleman's artery. And let me just point it out because you don't see this every day. This is the catheter here, and you can see these are narrowings in the proximal artery. This would be the kind of artery you would see in an 80 years old individual or so. And then it's totally occluded here from a blood flow.
Wow.
So what did we do? Basically went in and put a piece of metal called a stent in, opened this, and you can still see some clots distally which are being flushed out. It's interesting, I was on call this weekend, and the same story again and again, no different. 50 years old gentleman with a cardiac arrest came in. You walk out and talk to the family, and the question, and it is always the same, but he was so healthy. He never had any symptoms. How could he have a heart attack? And the second thing is, do you think he'll be going home tomorrow? And this is, these are the actual, this is very common. Let's look at what the mortality of this disease is. The price one pays. And this 15 to 20% will never ever even be able to call 911 or 911 or be able to go to the hospital. They die suddenly. And a good example this weekend, our Chief Justice died suddenly. Okay? And this is sudden death. It's a very, very common reason for death in this country. If you are lucky, Stella talked about reaching within a couple of hours, your mortality still is very high, depending on which hospital you go to. But it's running between 6 to 11%, which means that 6 out of 100 people, will not survive. But the story doesn't end there at all. Once you leave the hospital, you are at high risk for having recurrent heart attacks, and the recurrent heart attack rate is very high. So the question I want you to kind of think about is, can we prevent this? And I think that is the critical question. That's my focus of the talk today. So let me just repeat it again and again. The best treatment of a heart attack is never ever to have one. That is the best treatment. And the facts are that the choices are ours, and this is one of the most preventable diseases there is. It's not a disease of old age. You can essentially prevent it. And it's interesting. By the time I finish this talk, I think I'm gonna. What's the whole time period? What, 1 hour, Stella?
30 minutes.
Right. In 30 minutes, you'll have 60 people dead. Okay. By the time this day ends, there'll be 3,000 dead, 500,000 in 1 year. And the issue is, can we even prevent even half of this? It's a major issue. And forget about the cost. Let me talk a little bit about the cost too down the road. But where are we in Kern County? There are 58 counties in California. We are the number one as far as the incidence of heart attacks, heart failures, and cardiac arrhythmias. I'll be mentioning a little bit, or atrial fibrillation. One of the major risk factors for heart disease is diabetes, which again is a self-induced disease, and in adults. And essentially, we are also at the top. We are 57, and more than 60% are obese, which is overweight. The level of morbid obesity I'm not sure about, and obviously physical activity is fairly low. Let me talk a little bit about money because I think it's important, okay? If you look at the GDP, which is the total GDP of the country, I'm talking from 1960 to 2011, the GDP increased from 526 to 15,000, so about a 28-30%, 30 times increase. The cost of healthcare per capita increased 80%. If you look at the graph here as a percentage of GDP, we are spending more and more and more on healthcare. Incomes are fairly flat. The rate of rise, the cost of healthcare is increasing. And it's just, you don't need to be a genius. This cannot go on any longer. We have to look at things in a different way than we are doing at this point. And let's look what we are getting for this high cost. If you look at most Western countries, the life expectancy is no different. In fact, maybe a little bit higher. Yet we spend 2 to 3 times for the same, outcome. And I'd like you to think why. So let me talk to the focus on the actual, pathophysiology of this disease. Stella kind of mentioned a little bit. But, the good thing about cardiology is, I'll tell you, it's very simple. Okay, it's nothing complex about it. You have a muscle which beats, it needs energy. The energy is supplied by tubes, no different than what your plumbing system. There are 3 tubes. I showed you a gentleman with the right coronary, which was occluded, LAD and the circumflex. They're just funny names for these tubes. However, the vascular system is one of the largest systems in the body. It's a very sophisticated system. And what you have is a lining called the endothelium. You have a media, the middle, okay, which is a muscle, and then you have the outer layer. All of these are functions. They secrete hormones. They're able to dilate if you need to. They're able to constrict if you need to. And this is how heart disease starts. It's very important to understand that. If you look at the endothelium, it doesn't allow any junk to get out of the blood into the walls. But if the inner lining, which is the endothelium, gets damaged by risk factors, and I'll be talking about that, it gets damaged and you start leakage of stuff like cholesterol, etc., from the blood into the wall, and it forms a plaque. And you can see this yellow stuff. What is interesting at this point is, and this is where majority of the disease is, that there is no decrease in flow. If there is no decrease in flow, there are no symptoms. And that's exactly what happens, which we see all the time, okay? If you look at this, if there was no problem, life would be great. We could live with this, and most of us do. There's no decrease in flow, the plaque is there, okay? So everything is hunky-dory. The problem happens when in the middle of the night, for factors which are becoming very clear, this suddenly explodes or ruptures, the lining, the endothelium gives way, and within minutes, at times even seconds, you form a blood clot. And that's what the body is supposed to do. Anytime there's a cut, it tries to stop the bleeding. And this is, here you can see it's a lengthwise cut on an artery. You see little, these are blood clots. Here there's a large blood clot which cuts off the supply. That's when you start having the crushing chest pain and you come over, to the hospital and we end up putting pieces of metal in and so on and so forth. But the issue is, this has been going on for a long, long time. This is asymptomatic heart disease. And I think we need to understand this because we don't have to go to this stage. How early does this disease start? If you look at one of the finest parameters of atherosclerosis or the earliest endothelial dysfunction or intimal thickening, and if you look at it, it starts at very early on. Remember this, both animals, not our animals, but animals in the wild, and human beings are born with the same bad cholesterol, LDL of 50. The animals never let it go above 50 in the wild, not our pets, okay? And they never ever have hardening of the arteries or atherosclerosis. But we in our wisdom, usually by age 12 to 14, this LDL starts increasing, and we'll talk about risk factors, and you start getting damage to the arteries. In fact, by the time, I don't know how many of the audience is above 50, but statistically, almost 80-90% by definition do have atherosclerosis or hardening of the arteries. So, as the arteries harden, what happens? Those plaques keep on rupturing. And as they rupture, you get the complications, death, mortality, and many other issues. And you can see it's linearly progressive, which means as the longer the artery is subjected to risk factors, the more the plaque ruptures. Unfortunately, what we are seeing is, especially in Kern County, when I started, heart attacks were about 60, 65, 70. We are seeing them younger and younger and younger. The youngest one I did was 18 years old, female. Okay. I'd like to now kind of skip to a little town outside Boston. How many guys of you are from Boston or have been there? Anybody? Yeah, Don, you're from Massachusetts? Interesting. Anyway, I did my fellowship at the University of Massachusetts, and I know this, it's a little town. And I think this gave us one of the most important advances in heart disease where we could assess the risk. And if this is interesting, in this little town, which was mainly Italian, about 5,000 patients, including their doctors, agreed to examine them every year. Started in 1946. Now we are following the children and the grandchildren. And by following them, we came up who are the ones who have heart disease. And from this came the risk of having a heart attack, both in the general population and in individuals. And these are the risk factors you can see which came from this study. Now they divided them into two kinds, non-modifiable, which you can change. You can choose your parents. Sex, I guess you could change that nowadays. and modifiable. And these are also, modifiable means these are our choices. And as I said earlier, this is a disease of choices. Food, obesity, sedentary lifestyle, and because of this, nicotine, hypertension, and hyperlipidemia. These we can, essentially measure, okay? And based on these risk factors, all of us can calculate our risk over 10 years based on this. So, it's a very simple formula. You can actually download it. It's called the Framingham Risk Score. And based on your risk factors, you can assess your risk of having a heart attack over 10 years. I think I'll just leave it out here. So you have low risk, medium risk, and high risk. High risk meaning that over 10 years, your chance of having a cardiovascular event are almost 20%. These are the people who already have had a heart attack or who are diabetics but have no symptoms. Remember this, I'll show you the next slide, that if you're a diabetic, your risk of having a heart attack is very, very high. You know. So the major risk factors are pretty much still the same. Self-induced hypertension. The sodium intake in Kern County is very, very high. You know, average we are supposed to have about 2 grams, but it's much, much higher. High cholesterol, nicotine. So if you have 3 risk factors, your risk is not 3 times, it's 8 times higher. And combine that with little obesity and lack of exercise, and you have a very, very dangerous combination. I talked about diabetes. You know, the highest risk are people who have already had a heart attack. Your risk of having another heart attack is about, 18 to 20% per year. And what about diabetes? How many are diabetic or pre-diabetic? The risk of a diabetic who has no symptoms is the same as somebody who's already had a heart attack. Now, it's interesting, most of us live longer than 10 years, and if you look at, the risk, lifetime risk, and then, it's about 50%. Most of us will die from cardiovascular disease. And for women, it's very high too, about 32, So I would strongly recommend that all of you calculate your risk. It's very easy to do. You can, I prefer the Reynolds score because it includes some new blood parameters. But all of them are very good. You can use a 10 years risk score, or you can use a lifetime score. And how common are these risk factors? This is an old slide, and I'm sure in Kern County they're very high. But if you look at these risk factors, they're all under our control. Look at obesity, hyperlipidemia, physical inactivity, so on and so forth. Nicotine. And what is interesting is, if you look at, coming back to the question, that he was so healthy. When we look at it, it is not true, okay? But that's the perception. If you look at the connection between risk factors and your chances of having a heart attack, it's missing. In fact, this has been studied extensively, especially in minorities. The awareness that if you have risk factors, you're going to have a heart attack is very, very low. And remember, we have a very large Hispanic population, close to 50% or more. So what can you do as an individual? I think best thing is to assess your risks, okay? Have a good checkup, your blood pressure, your cholesterol levels, your diabetic screening. Cholesterol is a risk factor we can easily modify. We have great drugs compared to when I started practice. It's divided into LDL, which is the culprit, which infiltrates into the walls of the artery and causes plaques and heart attacks, and HDL, which is like a vacuum cleaner, which takes the bad guy out and sucks him out and throws him into the gut. So essentially, it's simple as that. And if you look at LDL, and as I said, we can easily drop it. And when we started the studies many years ago, we didn't have any strong drugs to lower the cholesterol, but even a little bit caused a dramatic reduction in heart attacks or heart disease. Nowadays, we can essentially dial your cholesterol anywhere you want to. And what is interesting is the lower you go, the risk becomes almost negligible. And remember this, that if your LDL is close to 50 or 60, you don't even need a high HDL because there's no junk out there to go ahead and vacuum. And so I think this is very important to understand. So there's no down limit to, and we are born with LDL of about 50. Inflammation and CRP is very important. Okay, I talked about the young guy, no major risk factors. LDL was high, was average for Bakersfield, but very high compared to what it should be. What happened is that this is another issue. This is a kind of diplomatic name for overeating and not, exercising. But essentially it's called the metabolic syndrome, where you're overweight, exercising less, And you have a few things, a little bit of each, a little bit high cholesterol, a little bit high sugar, a little bit high blood pressure. But when you combine this together, okay, it's a very, very deadly combination. It also produces inflammation, which we can measure, okay. Remember that obesity, especially abdominal obesity, produces chemicals. It's not like you're carrying 20 or 30 pounds. These chemicals then go ahead and affect the heart. And remember what the heart does. Compare, this poor guy has to beat 60 times or 70 times a minute. He doesn't get any vacations, okay? No sleep. Even when we are sleeping, he has to beat, okay? And he continues beating until we die. It's a very efficient organ, and the checks and balances. And if you look at this syndrome, which is almost endemic here in Kern County, and you look at people who have high CRPs, the risk of having a heart attack is extremely high. So this young individual I showed you, okay, was not low risk. He's a fairly high risk individual, And if you combine your CRP with the cholesterol, it is one of the, you have a question?
CRP, what does that stand for?
It's a C-reactive protein, okay? And it's a non-specific marker of inflammation. And if you don't have any inflammation like pneumonia or rheumatoid arthritis, and you don't have anything going on, it should be less than 2, okay? Yeah, and so it's a nuance. There are a lot of other markers of inflammation too, interleukin, etc. This is an interesting study, kind of tells you a lot of things, in our business. It's interesting. There were not many female cardiologists when, at least when I started. And if you look at the initial studies of, these are called randomized studies, and it's very simple. You take 1,000 people, and you follow them, and you take another 1,000 people and give them a medicine and follow them and see who has heart attacks and who doesn't, okay? Here you can see in this large studies, there are hardly any women. Here is 997 out of a pool of 6,000 or more. The Jupiter study is a very major study, and I think this is done by Paul Ritker from Brigham in Massachusetts. And I think it's a big breakthrough, and I would like to talk about it for a second, okay? What they did is took people who are low risk. In fact, their cholesterol is below average, but they had high CRPs. And it's a large pool of patients, especially women. CRP is a very important risk factor for women, okay? And what they did is they drastically dropped your LDL. These are people who had no symptoms, below average cholesterol, but high CRPs. And you got the largest reduction in any lipid trial of 47%, heart attack, death, etc. It's a dramatic reduction, pointing to the fact which I was talking about earlier, is that we have to assess a risk, and we have very good markers. So having no symptoms doesn't mean anything at all. So here we are. It's interesting, it took millions of years to come to make a very efficient machine. If you look at the cardiac, I'm amazed, even if you look at the electrical system, the pumping system, we have not been able to replicate it. But in about 50 years, we have messed with Mother Nature fairly, I would say, quite a bit. And you can see where we are now. And unfortunately, it starts very early on. We have a couple of us, attorneys, cardiologists, physicians, have got together and decided we have limited money, where should we start decreasing, the incidence in Kern County? And we decided we have to go to schools. We have to start very early on. Second thing, how far am I?
5 minutes.
Another 5 minutes, okay. Another problem we had, the numbers, it's called atrial fibrillation. It means irregular heartbeat. It's a major cause of stroke, and these strokes are not small. These are usually from large blood clots. And you look at the incidence, if you compare the incidence of atrial fibrillation compared to underdeveloped countries, make a guess how high it is. Is it 1 time, 2 times, 3 times higher? 5, 6, 7? It's 10 times higher. And it's closely related to obesity. And the price one pays is the incidence of stroke. And I see Dr. Conforth who does strokes in the back there. 5 times higher, dementia twice, heart failure, and all of it, And if you look at mortality after diagnosis, in the first 4 months, 9 times higher. Yet, 95% of this is preventable. And if you look at obesity and atrial fibrillation, just a 5-point increase in BMI, BMI is your weight and height calculated, or about say 10, 15 pounds, cuts this rate by 50%, or vice versa, increase it by 50%. And I think Stella pointed it out, the incidence of heart disease in women is very high, much higher than strokes, breast cancer, etc. And I don't think blood pressures, I think it's important for women, if you look at the incidence of blood pressure is fairly high. And in fact, what I do is I take the age and I'm -10, so if you're 70 years old, your chance of having high blood pressure are close to 60%, okay? And it's a big silent killer. And just controlling your blood pressure cuts your rate of heart attack, strokes dramatically. Diabetes, another one. Eating less, walking more, cuts your risk by almost, your chance of having diabetes by 50%. Adult onset diabetes essentially is a matter of exercise and the amount of calories you use versus, juvenile diabetes. So exercise is very important. If you look at it, it causes something which we cannot achieve by medicine. It dilates the arteries, makes them supple, etc., lowers your blood pressure, prevents diabetes, lower your cholesterol, weight management, a lot of other stuff too. So I think I'll go ahead and stop at this point because the main issue I'd like to do is talk about, answer your questions. But this is Mr. Harwell, nice guy. Married a very strong woman. Okay, and next thing you know, cigarettes are gone, booze is gone, red meat is gone. The next thing happens is he's dead. Okay? So what I'd like to do is stop at this. We can prevent death, but we definitely can prevent premature death. So thanks for your attention. So I'd like to go ahead and answer any questions that you have. And please be free. There's nothing unique about heart disease. Yes, sir. I'm sorry? Yeah. Depends what you're using it for, okay? One of the problems with heart disease, as I said, I showed you only blocked arteries. But one of the things which happen, these arteries cause is that this muscle dies and you get congestive heart failure, okay? And vasodilators are good for congestive heart failure because the heart, when it pumps, it doesn't have to pump against pressure. Vasodilators are used for high blood pressure, okay? But what's the best vasodilatation? Exercise, okay? It's a great way to vasodilate, before you get end-stage disease. Yes, ma'am?
You mentioned the HDL is very good between 50 and 60.
I'm sorry, Desiana?
You had mentioned that the
You have a mic.
HDL would be between 50 and 60. That's a very good number to be. It really helps with the bad cholesterol and what have you. How do you get the numbers up that high? Because normally, not normally, but they're usually low, 20, 30, what have you. How can you raise them?
Right. That's an interesting question, and it's a very good question too. Let me just put it, what is HDL? Okay, HDL is the body's defense against our behavior in many ways, okay? What HDL does is, it's like a vacuum cleaner, okay? It takes the LDL out, goes to the liver, and then it's treated out, okay? So the first thing I would do is start off with a low LDL. Diet and exercise is critical, okay? And what happens is the way to increase the HDL best is by exercise. We do have some drugs which increase HDL, okay? And statins are examples, okay? Another one is niacin. Statins increase HDL by 6-7%, niacin a little bit more, okay? But the way I look at it is there, if you don't have any junk, okay, you are not going to need a very high HDL, okay? Keep your LDL low, essentially. Now, if you look at the guidelines and what we are told to do, okay, I'm sorry, what we are told to do, is that basically you're not focusing on HDL. You know, we have used a lot of drugs to increase it dramatically. The trials have not been very successful, okay? So basically we're focusing on LDL.
You keep LDL low.
I would, you know, and I think, as I said, we can pretty much dial LDL wherever we want to. You know, we could not do that 20, 30 years ago. And the reason was we didn't have excellent drugs. We had great drugs with minimal side effects.
I'm skinny like that. Do you think I will have a heart attack?
I'm sorry?
I am skinny like that. Do you think I will have a heart attack too?
Well, as I said earlier, the best thing is to, and I don't know if we have it here, all of you can have your risk assessed right away.
So how much is the cost for the heart to be checked?
Right. No, the way we assess the risk or your risk of having a heart attack is to look at your age, blood pressure, cholesterol, which is a blood test. We can add a couple of other tests like CRP, etc. Look at your hemoglobin, and anybody can. You know, in our office or any office, any patient who enters should have the Framingham risk score done, and there should be given on a piece of paper what your risk over 10 years is. In answer particularly to your question, what is your risk? Okay, I really don't know. Okay, I really wouldn't know that.
But how much it cost for the test? How much it cost for the test?
You mean to have a risk?
Cost.
Hardly any. Now, if you already have gone to a doctor and you already have your cholesterol, there is no charge to it. It's free. You can do it in your own home. You can download a Framingham risk score calculator. You already have your blood test, okay? You have your blood pressure, you know, you have your family history, okay? You have your hemoglobin A1C, and that's all you need.
Oh, I don't need
You know,
to test.
yeah.
Doctor, I just want to ask, do you ever have to replace a stent once it's put in?
Yeah, that's interesting. Let me go back, okay? That's, you know, one of the, I think I would say the only privileges is you can talk a little bit historically about stents. What happened is, if there's a blockage, we used to open it up with a balloon. Problem was that a lot of these arteries would then collapse, and we were preventing a heart attack, and we would, you know, cause a few more. In order to prevent the artery from collapsing, we would put a scaffold, which is a piece of metal called a stent, okay? Basically, that's all it does. What happened is, when you put a piece of metal, you know, an artery is not used to it, he reacts to it, okay, or she reacts to it. And what the artery does is form a covering over that, and it was called restenosis, okay? And then in a wisdom, what we did is in order to prevent restenosis, we put cancer drugs on that piece of metal, so the artery was not able to go ahead and, you know, make those cells and, you know, fibrous tissue. It's called restenosis, okay? So in answer to your question, restenosis was about 10 to 15%, okay? It's getting much less now with the cancer drugs, but I would go one step upstream. The best thing is never to have a stent. It's not nature's way to put a piece of metal. Yeah.
I have a question. With people who are high risk, do you recommend any vitamins, oils, or a daily aspirin?
I personally don't, okay, and I don't see any reason for it, okay? Because there has to be some data to go ahead and show me that this vitamin or that vitamin improves, mortality or heart attack. And we have none. We don't even have for, what I recommend, if you really want to know is, I don't want to put it crudely, but what I would attempt is to eat less and walk more, okay? And if you have any risk factors, blood pressure, drop it down. LDL drop to the lowest. In our patients, in my practice, I keep it down at 50. And I can tell you, if you have LDL of 50, it's very, very hard to have a heart attack. Almost virtually impossible. Okay? Sir. Yes, sir.
What can they tell when they're going to give you a stress test?
Okay. What the stress test tells you only is that the blockage is more than 75%. It doesn't tell you if the blockage is less than 70%, 20, 30, 40, 50. And that's the problem. You can have a stress test which is negative, okay, and then 3 days later have a heart attack. Which comes back to the same point, okay? I mean, these are nice things to have, and the key is still prevention. Lower your blood pressure, lower your cholesterol. Yes, ma'am.